Okay. Hi, everyone. Welcome to our April Healing Circle. We're so proud to have our speaker here tonight. Our topic tonight is autism acceptance, and our speaker is Dr. Stacy Greeter. Tell you a little bit about Dr. Greeter. Dr. Greeter is a double board certified in both child, adolescent, and adult psychiatry with a private practice in Bradenton, Florida. Dr. Greta graduated summa cum laude from Duke University and went on to the University of North Carolina School of Medicine on a full scholarship. Dr. Greta completed her residency at Northwestern Memorial Hospital and continued there to complete her fellowship in child adolescent psychiatry. She loves sharing her passion with psychiatry with other professionals and increasing access to quality psychiatric care by educating community primary providers through her psychiatry boot camp for primary care online lecture series. Dr. Greta is a strong proponent for collaborative care between disciplines. She leads a psychiatry rotation for family medicine resident in Manatee Memorial Hospital, teaches child psychiatry fellows in University of South Florida, and runs a multidisciplinary mental health professional book club. Now, she is a busy lady, and we are so honored to have you. Dr. Greta, take it from there.
Thank you, Helen. Thanks for having me. This is a new thing for me. I have spoken many times as a psychiatrist, but I think this is the first time I'm speaking as an actual patient too. So I appreciate this opportunity. I am autistic. I'm also ADHD, but it's not ADHD acceptance month. It's autism acceptance month. So I'll be talking about that diagnosis that I have. And I did not discover this until age 40. The ADHD was obvious. That was age 6. So I'm telling you a little about my journey. First, I'll explain the neurodiversity paradigm, the idea that all neurotypes belong. So the traditional medical model of care is that what is most common in terms of brain functioning is best, and anything that doesn't fit that standard should be fixed. Whereas the neurodiversity paradigm recognizes both strengths and vulnerabilities in ADHD, autism, and dyslexia, and believes that all these different ecosystem of various neurotypes enhances the human race. So we are here to support other neurotypes in areas they're vulnerable and celebrate the strengths that they bring to our human community. What I was taught autism was during my psychiatric residency and fellowship training is very different than how I understand autism now. I'm very grateful for the new knowledge I have now. And I guess if there's one message I can send today, it's always be curious and ready to question what you've been assumed. So, traditional medical model of care. The goal is to make an autistic person look less autistic or find a cure for autism. Then in the neurodiversity model that we are shifting towards, because we believe that diverse brain types offer benefit to our society, the goal is to help the autistic person be their most authentic and most functional self. Neurodiversity does not sanitize the pain that people who are not neurotypical experience due to the world not being meant for us and not being designed for us, nor does it mean avoiding treatment or not taking psychiatric medication. What it does mean is that we are embracing both strengths and vulnerabilities and focusing on the individual leading their most fulfilling life versus focusing on them looking as normal as possible. So here we go. DSM-5 criteria, how I was taught, right? First is neurodiversity affirming criteria for autism. A deficit-based criteria, as the DSM-5 is based on disorders, and I'm not totally hating on the DSM-5, but yeah, it leaves a lot to be desired when it comes to my people. Abnormal social approach or failure of back and forth conversation. A neurodiversity affirming view of this symptom is autistic people talk passionately about very specific topics that are of interest to them and don't like the small talk thing generally. Deficits in nonverbal communication in DSM-5. Actually, in the neurodiversity affirming approach, we believe that there's differences in nonverbal communication. This can include stimming, looking elsewhere while talking, difficulty making eye contact because it's more aversive. And then in DSM-5, deficits in maintaining and understanding relationships. In the neurodiversity affirming model, we also talk about differences in communication. And these differences in communication can lead to autistic people being shunned by neurotypicals. Also in the neurodiversity affirming model, I'll just read that side. I like it better. Security and comfort in routines, because this decreases sensory overwhelm. Our sensory system experiences the world differently than a neurotypical sensory system, where certain inputs are much stronger for us, or we need more of certain inputs. Autistics feel very passionately about their special interests, and we use them for rejuvenation and emotional regulation. So let's go over the supposed failure of normal back and forth conversation thing. I am doing this right now. We affectionately refer to autistic communication as pebbling. Pebbling, like when a penguin comes over to another penguin and they're like, I have this awesome, great pebble. Here is this great pebble. Check it out. Here I am talking about autism. Psychiatry is my autistic special interest. I am very excited to share this special interest with you. I may find myself talking a little too long about my special interest of psychiatry when I get into social events. So here, the autistic squirrel, he's very into Pokemon. So he's like, okay, Squirtle, a water type Pokemon, evolves into Wartortle, and Aquatail is its biggest attack. And a neurotypical squirrel might be like, I just asked, how are you? I'm confused. What's going on here? Okay. But when two autistic bees get together, one bee who's really into paleontology can say ankylosaurus could not move any faster than a human could, walk with a layer of outer armor of thick plates of bone fused to a layer of keratin, even on its eyelid. Okay, and another autistic bee who's like super into metals and manufacturing is telling us, well, you know, Kevlar, steel, polyethylene, and ceramic are some of the best materials for body armor manufacturing. So they can have a back and forth conversation regarding their special interests. It just looks different than for neurotypicals. The social reciprocity presents differently. So, like I promised, when I was a little kid, teachers complained that I wasn't socializing enough. And a common myth about autistic kids is that they don't desire connection, which is certainly not the case for most autistic people. I remember I was on the playground, elementary school, kids running around, tag, etc. And I just didn't get it really, the screaming and the running. And so I would find my teacher and I would ask her about differences between gravity and magnetism and want to understand that more deeply. And I had another question and another question and another question. And you know, thank goodness for my my teacher, Mrs. Gordon was her name, because I still remember her, because she was one of the most, one of the people I felt most connected to in my childhood, because I could sit with her and ask her questions and talk about science for hours. I think that she felt guilty that maybe she was enabling me but to not make friends by sitting with me in recess, answering all these questions. But that's how I was connecting. I was connecting through sharing joyous information that was an interest to me. Autistic people, we tend to connect through a special interest. Um, Even if we don't quite understand what's going on with all the neurotypicals. When someone shows an interest in us, we connect very deeply, very strongly, sometimes even more intensely than non-autistic people to our loved ones. And that was a time when I could feel some peace and some belonging when I sat with her. I was bullied and ostracized a lot, and sometimes she wasn't on the playground, and teachers would say, okay, you need to go play, right? You need to go out there and play. Okay, so not understanding that talking about science was play for me, I was like, okay. So I scanned the playground because I was off on my going to make a friend assignment, and I would pick out whichever student seemed to be the most lonely, who looks like the most sad, lonely person I can find out here. Okay, so then I would walk up to them, right? I knew they had the least chance of rejecting me. And I would simply ask, do you want to be my friend? And rate if they said yes or no. And if they said yes, I was like, great, job done. I have followed the teacher's instructions. And they would talk to me. They would be like, Stacy, do you know how to make friends? And I'm like, well, duh. You walk up to someone, you ask them if they want to be your friend. If they say yes, they're your friend. I couldn't figure out why people were so concerned with me making friends. It seemed so simple. Um, Generally, autistic girls in particular, and those assigned female at birth, exhibit a lot more social motivation and are more likely to initiate friendships. And it was very friendly child, but may struggle to maintain them over time. They may accidentally say something that not understand something was confidential that the friend shared with them, or various other ways that the relationship sours. So I initiated some relationships, but if that peer was no longer lonely, you're kind of no longer needed me to take care of them and serve a purpose in their life. It was hard for me to maintain it. And looking at this little girl, that's me. You probably don't think she's autistic, right? She's making eye contact. She's like, hey, I don't know what. I'm probably talking a very long time to Santa Claus in this image. And that's me in ballet before I got kicked out of ballet for being too hyperactive. That was my ADHD at play. They told my parents, I think maybe you should try gymnastics for Stacy instead. So remember that also for autistic kiddos, it can be a lot easier for them to connect to adults than it is for them to connect to their same age peers. We shouldn't expect autistic kids to connect in the same ways neurotypical kids can. I think it's important to learn how they need to connect with us. I believe that it's important that kids understand how to mask and look neurotypical if they're going for a job interview or they get pulled over by the police, of course. But to also have someone cultivating the ways that they connect is important too. In my life today, I specifically seek out a lot of places where I can talk to people about my special interest of psychiatry and also learn from other people about psychiatry. So I create these opportunities for myself. I am not lonely and have a lot of socialization. I'm really lucky. I'm actually one of the most lucky autistic people, I think, ever to be able to do psychiatry, to be able to run my book club where I can talk about psychiatry and do my presentations. I also have a special interest in fantasy creatures, so I can combine my special interest in fantasy movies with my special interest in psychiatry, and I can, we lovingly call it info dumping when we talk at length about our special interests. I can do this socially accepted form of info dumping by teaching the world about psychiatry. Also, meeting question is on. Got it. Sorry about that. Before I understood a lot about autism, I got a lot of feedback from other people who didn't understand me, who told me I needed to get a life. And I think I judged myself too. I tried to do things that I don't know other women do, like getting manicures. I hate manicures. You have to sit still, and the sensory experience of a manicure is really uncomfortable. And then the lady asks you really like superficial, useless questions. So I would go and I would try to do this whole getting a life and relaxing thing, right? To go and get the manicure and then feel kind of like a failure for not enjoying said manicure and really wanting to go read and teach and learn psychiatry instead. And now knowing that I'm autistic, it makes sense. I have a life. It's just that what enlivens me as an autistic person is different than what enlivens neurotypical people. And I'm really grateful to have a better understanding of that now. In general, autistic girls compared to autistic boys will display more appropriate special interests. Like, for example, many girls may love fantasy creatures, but there's a difference in the intensity of that interest. Most girls don't spend weekends making Disney princess themed PowerPoints on perinatal psychiatry. That is generally a sign. So when I get to do psychiatry with patients, it feels kind of like going from a fish that's been flopping around on land to finally getting to swim. Psychiatry is all about curiosity, exploration, understanding without any need for social rules. It's about what honestly is happening between two people. Psychiatry communication is direct, authentic, and honest. So I feel very at home as a psychiatrist. It's like a BS-free zone in my office, and I like that. I don't have to do any superficial small talk. Stimming. Stimming refers to repetitive motions that autistic people do to emotionally regulate our nervous system. And there's a lot more than just stereotypical hand flapping. That is what people think about when they think about diagnosing autism. And a lot of girls like me who are very intelligent fly under the radar for a long time. But looking back, and part of why it meant so much to me to finally have an autism diagnosis, which shocked me when I first got it, by the way, because so many different things made sense. And these different things that I did, instead of being these weird idiosyncrasies that only Stacy does, suddenly became, well, those are things that autistic people do, that I just belonged to a group of people in these things. One of them is stimming. When I was a child, I would go onto the swing outside And I'd be out there for 5 hours imagining things in my mind. I had a rocking horse. I would go to my room, right? If it wasn't outside on the swing, I was inside on my rocking horse, Anna, and I was there for 5, 6 hours imagining things in my mind. Yeah. It was a rocking horse with the springs. And I remember my parents all the time. I rocked on it so much. My parents had to keep replacing another spring, another spring, another spring. So we had a huge supply of springs. I take my crib. Yeah. Take it across the room, and there were gouge marks. So it's very important that we encourage autistic kids to engage in stimming because it helps regulate their nervous system, as long as they aren't doing something that's harmful to themselves or others. It's a prime example of how the medical model can get things wrong if we are doing therapy that is trying to extinguish stimming so that a child looks more neurotypical and fits in better, because internally that child will be experiencing more distress. The neurodiversity affirming model of care recognizes that an autistic nervous system has different needs that need to be honored. Now, monotropic attention style. This video, you can go check it out and write down the link, explains monotropic attention style better than me. But it's like when we autistic people get into a flow state when something captures our attention, that's tremendously powerful and enjoyable. So I could be lost, on my swing within a story that I created of my own for a long time. Being suddenly ripped out of this state actually can be physically painful. I imagine it like this is the mandrake from Harry Potter. Like you're in your cozy pot and your roots are burrowing deep and you're learning more and more. And then suddenly ripped out. And it can't actually, it's like psychologically painful. And this can cause some autistic kids to have a meltdown when taken away from their special interest. So sensory differences also contribute to meltdowns. Autistic people don't habituate to intrusive sensory stimuli over time, the same as neurotypical people. So they can't just tune out something that is bothering us. And yes, all the tags were cut out of my clothes. And I was always in trouble because I never had my shoes on in class because I didn't like to wear shoes. And on the side there, you see these little, I collected these as a kid. These are they actually use them as bait, but I loved how they felt. So I had a huge collection of these little worm guys. Every time, we would go to something that had like a fishing thing, I would be collecting more and more worm guys, and my hands would be in the little worm guys. And I was very sensitive to noises growing up. I also still have my baby blanket from childhood. Mm-hmm. I'm not ashamed of that. I like how the corner of the blanket, I put it in between my fingers, and nothing feels the same way as that baby blanket in between my fingers. And that's a form of stimming too that I do to regulate myself. People for the longest time were like, why do you still have this blanket? And I'm like, I like how it feels between my fingers. Why not have my blanket? Who does it harm? So yes, you can tell people that Dr. Breeder still has her baby blanket. And I only use natural lighting in my office. Before I knew I was autistic, I would try to just put up with fluorescent lights, etc., and tell myself, oh, you're being sensitive, it's not a big deal. And now I am able to really understand that modifying my sensory environment so I can harness the optimal functioning of my brain is key. Because lots of people need my brain. A lot of people need good psychiatry. And the way to do that is to optimize my sensory environment instead of tell myself too bad. So a lot of this is learning to, I think a lot of my what I'm teaching my patients is about learning to tune in and respect the needs of their nervous system that can be different. And then there's slow processing or just much more information to process. So the data shows that the neurotypical brain is kind of like just got this gestalt sense of what's going on. Okay. Whereas the autistic brain, the autistic cauldron here, is taking in all of the sensory details, all of the language details, analyzing other people's behavior, and figuring out what's expected of them. And so the autistic brain is less prone, what's the word? The things you see that are, all right, I can't think of it. Like where all right, it'll come to me later. Anyways, but like the autistic brain takes in reality more as it is. It's less susceptible to illusions, like visual illusions. But there's a lot, it takes a lot longer to think through things and process things. My 7th grade teacher, I remember her telling me I'd never become a doctor, that my patients would die on the operating table because I was so slow at writing. I was fine though. And it wasn't that I was actually slow. It was that I was processing so much more stuff. So we may take longer to respond to questions and think things through. I also have an auditory processing disorder, which makes it takes a little bit longer for me to write and process information. A common myth is that autistic people lack empathy or don't have a theory of mind. I was taught this in residency and fellowship. This is the biggest reason that I didn't think I was autistic, or at least didn't realize I was autistic for so long, because I have a very intense theory of mind. I've actually been functioning as a people detective from a very, very young age so that I could survive and figure out what people wanted from me. Theory of mind refers to one's ability to take in another person's perspective, to recognize perspectives that are different from their own. This is very harmful to autistic people, this myth, because at the same time that researchers were defining theory of mind and perspective taking as what makes us human, they were claiming that autistic people did not have this ability, thus robbing autistic people of humanity. So where did this myth come from? First of all, sorry. Many autistic people, myself included, are actually hyper aware of the emotions of others, experiencing them more intensely, and have a strong sense of social justice and care for all life forms. And that's why I do advocacy work in psychiatry. It's something I need to do. I can't not do it. Alexithymia, which happens for about 50% of autistic people, and basically means like color blindness for one's inner emotional states. So the myth that autistic people lack empathy came from this partly came from some autistic people who struggle to perceive their own emotions and the emotions of others. Again, that's not all autistic people. That's about 50%. This is common in ADHDers too, by the way. think of it like having jelly beans and different flavors represent different emotions. And with alexithymia, it's like the jelly beans got melted together. You still have those feelings. You just can't distinguish the different feelings from each other. Society's traditional perception of autism was based on a subset of autistic people with severe alexithymia. So these people struggled to perceive their emotions and other people's emotions. It wasn't that they didn't care about other people. It was difficulty with that internal emotional perception, which is a skill that can be cultivated. Again, one reason that girls more commonly fly under the radar being autistic is because we tend to be on the other end of the spectrum with extreme sensitivity to other people's emotions. Now, I've skipped ahead a slide. Let me explain this first. Then the other slide will make sense. Sorry about that. Okay. Interoception. Interoception can be impacted by the autistic nervous system. It's our ability to perceive when we're hungry, tired, have to pee. And this can contribute to meltdowns as well because we don't pick up on these body cues until they're very severe. So you look in this picture, right? My husband can attest to this. I don't notice that I'm hungry until I am raging hungry. It's like a neurotypical person will be like, oh yeah, I'm a little hungry. I better take care of that. And I'm just reading, learning, doing psychiatry, doobie. Oh my God, I am like sick hungry. I'm gonna kill someone hungry. Yes. Yes. My husband told me that he wishes that he could go back in time to his younger self dating me and tell himself, don't have any serious conversations with Stacy until you dim the lights and you make sure she is fed. Then you can bring up the serious topic that you want to talk about. When I was a little kid, and not even that little, this was like, okay, 7, 8, 9, 10. I didn't realize I had to pee until I was about to pee. I did not pick up on my bladder giving me an interoceptive cue. Hello, I'm starting to get full. And then by the time I had to pee, I had to ask the teacher, hello, excuse me, teacher, I need to go to the bathroom. So I got in trouble a lot for partially wetting my chair in elementary school all the time. And there was all kinds of interventions of like, punish Stacy and do this for Stacy and do that for Stacy because she keeps like wetting her chair, must be doing it to give us a hard time. I bring this up because it's really important before we enact a behavior plan for a kid that we ask ourselves if we are asking something of them that they are actually not capable of doing, and then blaming them for it. It's really painful when you're a kid and the adults around you think that you're refusing what you're really trying hard to do. When you're trying so hard to comply. And it has been shown that autistic people who are more intelligent, autistic people who appear more neurotypical, actually experience more severe bullying and more severe discrimination. That's shown in studies. People often misinterpret them as being intentionally deviant, whereas someone who looks more obviously autistic, they're more likely to understand that this is something they're not capable of. Yeah, my teachers, they couldn't process so how's this like ridiculously brilliant little girl not able to get to the bathroom on time? That doesn't make any sense, right? She must be doing it on purpose. Compassionate empathy is quite strong in autistic people. It's often heightened, actually. This is feeling, so affective empathy is feeling with people, okay? I see you're sad, and the little mirror neurons light up in my brain, and I feel sad. Compassionate empathy is feeling for other people. We tend to greatly value fairness, equality, and treating others the same, irrespective of social hierarchy. And yes, that treating others the same, irrespective of social hierarchy thing, got me in a lot of trouble in my formal education, especially residency and fellowship. So that brings us to social justice sensitivity and struggles with hierarchy. Yeah, that's me in the middle there. That's me in the middle there. I think I'm 10 in this picture, but I'm not sure. Okay. And I remember clearly, but this little girl, Leanne, when I was in second grade, whoops, let me go back. Okay, I was in second grade, and I liked Leanne. She was one of the few, she was a nice little girl. She's one of the few people who didn't bully me. And one time the substitute teacher said something not very nice to her, and I was mad. And I was like, this isn't fair, and this will not stand. And I wrote a long letter in complaint about how she was harming our social emotional development and harming our self-esteem, that she was hypocritical in asking for respect while she was treating us disrespectfully. It went on and on. That is an example of social justice sensitivity. And autistic people tend to be kind of the whistleblowers in society when things are not right. And I'm part of an organization called Autistic Doctors International. So we get together on Facebook, and someone will ask a question. Okay, so this is going on with this neurotypical person. What do I do? And there will be pages of very detailed analysis to help them understand what's going on. Like, these are things that like neurotypical people don't think twice about, and us autistic people are spending like tons of energy figuring out. It also makes us good psychiatrists, though, because we spend a lot of energy and time thinking and figuring out what's going on with these other human beings. And not assuming. I naturally relate to people the same, whether it's my waitress at a restaurant or an attending or a famous person. It's how I relate. And that made medical training extremely, extremely painful for me. It's a reason that a lot of autistic doctors may not even finish med school or residency because of difficulty towing the line in the social hierarchy. So it was fascinating because I remember in residency at the same time, my patients were just profoundly attached to me. My certain attendings were extremely pissed at me. And they're very mixed opinions. And looking back, I understand. It was because us autistic people will struggle when there's a certain way and deference and subtle communication that's required to give someone higher in the hierarchy than us the deference they perceive that they deserve. That can be hard. And this is one of the reasons, this is actually the main reason I didn't go into an academic institution. That was previously my dream, to do academic medicine. But the hierarchy of an academic institution and the politics would just be too toxic for me. So I'm really grateful that I can do private practice, and do it exactly how in line with my ethics, with and surround myself with people who I can create a work culture of equality and direct communication with. I'm really lucky. So how the more on empathy and autism. So basically, cognitive empathy, that's the theory of mind thing we talked about earlier. Understanding another person's perspective. And understanding the perspective of someone with a different neurotype than yours is tricky. Dubbed the double empathy problem by Milton. A autistic person actually understands the perspective of another autistic person better than a neurotypical person understands the perspective of an autistic person. Whereas when an autistic person is trying to understand a neurotypical, it's confusing. Okay. Thus, we are discovering that it's not a lack of theory of mind in autistic people or a lack of ability to understand perspective. It's that there's a miscommunication across neurotypes. And I've noticed this. When autistic people find other autistic people, there's like a zing. There is a connection. Okay. There's something like you get it. Okay. There's a thing that you can get it. And so I have many very close, very dear neurotypical friends and supporters. My husband, for example. And so I'm really fortunate that I can surround myself with the people who love and accept me as I am. Because not all autistics are that fortunate. Autistic culture versus neurotypical culture. So instead of thinking of it as a lack of perspective taking, we think of it as a sort of cultural misunderstanding. Autistic communication is direct and clear. In neurotypical culture, you say things subtly so people don't think you're respectful or imply things. That's at least what attendings in residency expect mostly. In autistic culture, communicating the most accurate information clearly is a priority. In neurotypical culture, protecting relationships within a social hierarchy is more important. In autistic culture, we value what's logical and expedient, and neurotypical culture puts a little more emphasis on what's socially acceptable. I want to emphasize here that not knowing the socially expected response, not knowing what someone else expects of us socially, is not the same as not caring about other people, though it can often get misinterpreted that way. I'll tell you, I remember in fellowship being on call. And so the nurses would call you when there was a new patient, and they would be like, hello, Dr. Greeter, how you doing? What are you up to? There's a new patient. When can you get here? They didn't want to know how I was, and they didn't want to know what I was up to. And I didn't know that. So I'd be like, all right, I'm at home. Oh yeah, well, I'm at home and I was watching this cool show. And I'm gonna finish this my burger, and then I should be able to be there in about 30 minutes. Cool. So I found out, a month or two into my fellowship that the nurses complained that I didn't care enough about the patients because I was talking to them about finishing my burger or whatever, and then I would be there for 30 minutes. It was TMI. My attending took me aside and she's like, when they call you and they ask how you're doing and what you're up to, just say, I'll be there in 30 minutes. So that's an example of how not knowing the expected response and taking things literally can lead to people thinking that you don't care. And unfortunately, first impressions last. They really do. So this is hard. So miscommunication is painful. Autistic people are more vulnerable to being manipulated and TMI, sharing too much, not knowing that something a friend shared is confidential when they didn't spell it out, you know, especially because certain things that, maybe neurotypicals would be embarrassed by, I really have no shame about. I really don't understand, right? Um, we have a lot more difficulty feigning interest in non-preferred topics. We are called too direct. Now in psychiatry, part of why psychiatry is amazing. I know I'm going to say this a lot, and I've said it already, but when I'm doing psychiatry and my patients tell me something, um, I naturally say, "Oh, so you mean dot dot dot?" And then the patient's like, "Yes, you understand." Or the patient will be, "No, you didn't get it, Dr. Greeter, dot dot dot." Okay, so you mean actually blah blah blah. The conversation that we have, it's natural for the doctor to clarify, to summarize and reflect. Patients find that to be to show they can tell that I really want to understand exactly what they're trying to communicate, and I really care. So it works out for me. It's not reflective listening isn't something that's socially appropriate when you're at a party, but it works well in psychiatry. And then um, um, now, oh, I was going to also mention another thing. I talk to my office staff. I say, if you say it subtly or in passing, I might miss it. And it's not because I don't care. I really do care. So if at some point you get a little feeling or thought, Dr. Gritter, she doesn't care about what I just told her, say it again more directly and see what happens. And my staff is really good about this. I'm really lucky. Recently, for example, my PA, we were in a meeting and my PA says to me, "I don't know how this patient got on my schedule. They're a really tough patient." I said, "You're right. They're a really hard patient. Let me know if you need help with that. I don't know how they got on your schedule either." Went about my day. Circle back later, I was like, I don't think this patient should be on your schedule. I think only I should see this patient. And they're like, "That's what I was trying to tell you, Dr. Greeter." um, and and so I explained, I said, "Okay, I understand what happened, right? Next time, tell me, Dr. Greeter, I don't feel comfortable treating this patient. I would rather them be with you. And then I will understand." And because my PA is awesome, and she really is, I am so grateful. I have like the best PAs in the entire world. They aren't offended. They don't take it personally at all. They do exactly, they are like, "Okay, next time I'll communicate in the way that's going to be clear." Um, Neurotypical people can benefit a lot, actually, but more direct autistic communication too. Um, in a culture of safety and directness in the workplace. So, um, I see a lot of clinicians who avoid diagnosing autism. They don't want to see it. They think it's going to be a tragedy. They think it's bad news, or they say, "No, I shouldn't tell the patient because it's going to make them feel bad. I don't want to make my patient feel worse." Um, discovering that I'm autistic and understanding that lens through which I view the world has made me so much better at psychiatry and more fulfilled as a human being. There's a quote I'm going to share from this book, which I think is a great resource for people wanting to learn more about how to diagnose autism and not miss it in their patients. Is This Autism, a guide for clinicians and everyone else? And here's the quote. Only accurate and neurodiversity affirming self-understanding can free an individual from a lifetime of self-blame and shame. Countless autistic individuals have beautifully expressed the freedom and validation they felt when they were finally recognized as autistic. For many, understanding themselves through this lens has enabled them to experience less emotional distress, engage in better self-care, feel a sense of community, and advocate more effectively for their needs. So it helped me to undo the labels I gave myself before. Misfit, overly sensitive, selfish, difficult, weird, too intense, oppositional. Yep, I had all those. And change them up. Brave, an expert, an advocate for the underdog, unique, logical, creative, conscientious, persistent, outspoken. These are all traits of autistic that are particularly resonant in the autistic neurotype. So, autistic strengths. I am very fortunate to be able to do the work that I do. I practiced for it my entire life, as a tiny people detective from a very young age. And so psychiatry comes very natural to me, and I feel at home there. My hyper empathy and honesty and comfort directly talking about any taboo topic, and getting right at the meat of things, at the real meaning and heart of the matter, without any need for this small talk. And also there's the fact that I'm utterly obsessed with learning more about psychiatry. These have all helped me. So I want to say that there is a lot of hope that it is possible, and quite common actually, for autistic people to find their home. And so I'm grateful. I'm grateful to be able to speak about this and share it, because I know that most autistic physicians don't feel safe speaking out. We are viewed as lesser, and it is there's real discrimination that goes on, and I am in a place of relative privilege and safety because I'm my own boss at my own private practice. So I feel strongly the need to speak up, because I have this privilege. For the autistic people who can't, who aren't as safe as me, the autistic strengths include honesty, hyper-empathy, detailed perception and processing, outside-the-box creative thinking, logical thinking, being less influenced by social norms, just to name a few. Happiness can be found even in the darkest of times if only one remembers to turn on the light of self-knowledge through accurate diagnosis. So clinicians out there who are listening, I would encourage you that if you suspect, I would encourage you, first of all, to learn more about autism so that you don't miss this in your patients. Black autistic children are almost 3 times more likely to be misdiagnosed than white autistic children. most commonly adjustment disorder or conduct disorder when they're actually autistic. So the color of people's skin impacts their ability to get adequate medical care and an accurate diagnosis. I dedicate this presentation to many unseen autistics, women, genderqueer, and people of color. So, talking about masking. So masking is when an autistic person essentially pretends to be neurotypical as best they can. They mimic what neurotypicals do. They accommodate, they perform, and suppress talking about their special interest or stimming. I don't really do this that I'm aware of, for better or worse. This is why I struggled so much to get through residency and fellowship. And it had nothing to do with the learning material, of course. It was all doing what the attendings expected of me. Yeah, because I'm not a masker. But masking comes at a great cost. It takes tremendous amounts of energy. I don't mask so that my brain is fully available to be with my patients and when I'm not at work with my loved ones. But the decision of whether or not to mask is a cost-benefit analysis. Many autistic people don't have the privileges that I have. And masking decreases risk of rejection. Society is more willing to listen to us. We have greater job security, safety, versus not masking. There's a lower risk of suicide, anxiety, and depression, more energy and creativity, authentic self-understanding, authentic relationships, freedom. What about for society? When autistics mask, social systems feel more comfortable. They're secure in the status quo. They're more stable. They don't have to face flaws and inequalities or inconsistencies. And when autistics don't mask, society gains novel insight. Social systems are challenged to grow, improve, change. Different perspectives are valued. We have to grapple with inequalities. So we need all brain types. And I think it's worth questioning not just what autistics lose when autistics are masked, but what our world loses when autistics are masked. We are less susceptible to implicit social biases and more easily come up with novel ideas. We learn more equally from both desirable and undesirable information. So we're good at data collection. Neurotypical brains are more prone to collecting data to support a particular preconceived idea, whereas autistic brains, as bottom-up thinkers, tend to form less biased hypotheses. And we enjoy deep dives into areas of special interest and tend to become experts in areas. So Matt Lowry, I like his quote here. He's an autistic therapist. He says, I really believe that living in a more autistic way is beneficial for everybody. When we acknowledge autistic needs, even neurotypical people can acknowledge their own needs and live more effectively and live happier, more productive lives. Because instead of just focusing on the grind, we focus on ourselves. We help our community. We change the world around us for the betterment of all the people, not the betterment of the system. So I choose to disclose that I am autistic because even though I escaped to my residency and fellowship and get to do what I love, many autistic doctors don't, or many autistic people don't. I can direct my own learning now and have autonomy to select the people who I want feedback and mentorship from. And I want to use this position of relative power to speak up for medical trainees who haven't made it out yet. And so one of my special interests now is trying to improve training for neurodivergent physicians so that we can have more of us. There's a lot of brokenness, shame, feelings of not belonging, and feelings of inadequacy that build up over years. Like there's a fun autistic child or neurotypical child for the neurotypicals too. Let's face it, okay? This isn't just for autistic people. Inside us that has been smothered to try to fit in and belong. Because it was taught for years by authority figures that their way of being is broken or needs to be fixed. And it can take time to access and recognize our authentic self and really bring that into the world. It's a process. I also want to highlight that the autistic nervous system is not the only thing that's different about an autistic body. We are more likely to have sleep issues, connective tissue disorders. I have celiac disease. We have GI system issues. I have autoimmune conditions. I have a couple of them. I have some dysautonomia, and I'm hypermobile in my joints. There's a lot of overlap with Ehlers-Danlos. The resource All Brains Belong has a lot of great information on the medical needs that are unique to autistic people, because we are more likely to have all of these things that go together. And this is great. Mel Hauser is the one who started the All Brains Belong neuroinclusive healthcare community. And there are toolkits that clinicians can use where a patient can describe their symptoms ahead of time, fill it out, be ready for their appointment. Navigating the healthcare system, it's a challenge for all of us, but it is a particular challenge for autistic people. The sensory environment of appointments, being put on the spot, being asked questions, and having to verbalize things. I really encourage my autistic patients to write things down ahead of time. And my patients who have difficulty verbalizing things on the spot, as many autistic people do, fortunately, I don't have that problem. I'm quite hyperverbal. But I will write down all the questions I have for them before the appointment to give them a framework. And you don't know everything you want to ask, of course, but you can say, hey, what is most important to talk to Dr. Greeter about, today? What are the side effects of your medicine? What is the benefit? What are you most proud of doing lately? Anything Dr. Greeter did at the last appointment that upset you? I love that question. I get some good responses there, and this is important stuff for us to talk about. Dr. Mary Doherty, who's an autistic doctor in Ireland, and she started Autistic Doctors International Group, has a great article. She calls it the triple empathy problem. So instead of the double empathy problem, which is between a neurotypical and autistic, the triple empathy problem is that between doctor and patient, there's already a misunderstanding. And then on top of that is another layer when it's a doctor and an autistic patient, a triple level of misunderstanding. And she uses the acronym of modifying the sensory environment, like not having distracting noises or dimming the lights. Predictability, explain to the patient exactly what's going to happen during the appointment. Don't expect them to just know. Acceptance, I think it's kind of obvious, that one, but you know, if they're stimming or they want to bring like a fluffy fidget or something, it's okay. You know, that works for them. Give them more time to communicate, maybe even prompts ahead of time so they don't have to try to communicate on the spot during the appointment. And of course, empathy. So I also want to emphasize that the attitudes of clinicians and family matter. If we think of autism as a tragedy, that is going to be felt by our patients. I'm going to read another quote from Is This Autism book. If a clinician thinks of autism as tragic, they will be disinclined to look for it, diagnose it, and openly discuss it with their clients. When these clinicians do discuss autism, it will be with trepidation, anxiety, and pity. How else does one present bad news? So I also want to challenge us today to view autism a little differently. Clearly, my life has not been without its challenges, and being autistic, it did make it a lot harder growing up. And I'll be honest, before I understand neurodiversity, I used to wish the one thing I could change about myself was that I would never have ADHD. And now, and ADHD is annoying. It's really frustrating. And some things about being autistic are really annoying and really frustrating. But without my ADHD, I wouldn't be making Harry Potter themed presentations. And I wouldn't have that creativity and passion and drive to do the things that I do. And if I wasn't autistic, I wouldn't be the human being that I am today and the psychiatrist that I am. And I'm really grateful for that. So I've been able to come to a place where I value and am grateful for having a different neurotype, actually, even though it's not without its challenges. And want to leave with my last slide. What about the neurotypical supporting their loved ones out there? And I thought about putting my husband's phone number on this slide because he is the expert on how to support an autistic person. But I won't do that to him. He is the poster husband for it. He says to me stuff like, you know, your autism is a big reason why I love you so much. You're not like other women. You don't just want things because society tells you that's what women want. You're like a blank slate that's just you. I'm embarrassing him right now, I'm sure. And I'll be there, you know, stimming and stuff, and he'll be like, "You're so cute." He's like, "Those little noises you make are just adorable." So, when I first got diagnosed as autistic, the first thing that I worried about was, oh my God, you know, am I shortchanging my husband because he has to be with an autistic person? He doesn't get to be with a neurotypical person. And I'm very grateful that my husband routinely confirms that he does not consider this to be the case at all. Yes. And there is a balance of accommodation, right? Ideally in the relationship. For example, my emotions are very big. My emotions are very strong. And my neurotypical husband's window of tolerance for big emotions is much smaller than mine. So we both stretch, right? I try to be softer in how I come forward with things, and he stretches in terms of his comfort level with big feels. And we find a way to try to meet in the middle. And that's another thing I want to emphasize is that um it's not about the autistic person fully accommodating the neurotypical, and it is not about the neurotypical fully accommodating the autistic person. It's about us finding a middle path between our various different human needs. I recommend that if your loved one is autistic, you learn as much as possible about autism and keep celebrating what makes them them, and communicating about what each one needs. I also have an amazing office staff and my amazing PAs uh, who support me so much. I couldn't be the psychiatrist I am without them, and I'm really grateful. So um, I'm one of the lucky ones who has amazing people behind me.